Hello, friends. Very interesting question from the recalls. A man requested HIV test as some of requirements needed for his work. He doesn't have a sexual relationship with any other than with his wife. There have been they have been together for a long time, and she as well doesn't have any relation with other partners. He denies abusing any drugs and no history of travel. His results were as follow: Eliza, which is positive, and Western blot, which is negative. So now, as we can see in the scenario, that patient is requesting for HIV test for that he need for his work, and in history he's giving that he has a no sexual relationship with any other than his wife, and his wife also doesn't have any other relationship with other partners. So, and he's also denies abusing any drugs or any other travel history. So these all risk factors are which should be there with the whenever we are suspecting HIV positive. So here they are asking, what is your interpretation for this result? When ELISA is positive, Western blot is negative. So what could be the correct option from out of these four options? So we will rule out one by one as the options they have given. A, false positive test, and B, patient has just got acute HIV infection. In option C, he's in the window period of HIV infection. In option D, patient had already HIV long time ago. Means he's having some chronic infection, chronic HIV infection. So as we can see that patient has just got acute HIV infection. This is not the correct answer because in acute HIV infection, ELISA will be positive and Western blot should also be positive. As here we can see that ELISA is positive, but Western blot is negative. So patient has just got acute HIV infection. That is not the correct option. And next one, which is option C, he is in the window period of HIV infection. That is also not correct. Why? Because in window period, ELISA should be negative and Western blot should also be negative. But here we can see that ELISA is positive, but Western blot is negative. So this is not the window period of HIV infection. In option D, which shows that patient has already HIV long time ago, or chronic patient is having already chronic infection. That is also not correct because in chronic infection, ELISA and Western blot both should be positive. But here we have only ELISA positive. So the correct answer is the false positive test. Commonly we go for the two tests, which is ELISA. One is ELISA and another one is the ELISA is for the screening test and Western blot is for confirmatory test. So whenever we see the ELISA positive, we go with the Western blot test to confirm either this is HIV or not. If Western blot is negative, without this report, we cannot confirm that this is the HIV, means HIV positive, because with ELISA test, actually this test is a very rapid test and less expensive. So commonly we go for the screening uh, for the Eliza test. But what happens? There are and sometimes it reacts with non-HIV antibodies, like from autoimmune disease, recent vaccines, or pregnancy. It can show positive ELISA. So whenever ELISA test shows is positive, but Western blot is negative, it means this is the false positive. So in this question, correct answer is false positive test. I hope you understand this question. This is a very important question. This is a very interesting question also. Thank you very much.